Hi, it's Jenny D and Health Tidbits with Dr. Kohli, of course, here as an expert on 9 News. Also, Cherry Creek Heart accepting new patients. If you're looking for a doctor at this time, she's fantastic. Comes in, gives us stuff to think about. And right now, of course, tax season, everything else, all the bills piling in from the holidays. Let's talk about financial stress and heart health. So why did stress even evolve?
Yeah, this is a big one for me as a cardiologist. And so stress, if you think about stress, it's a protective mechanism. So it's just like pain. It evolved to protect us. You know, you see a lion or a tiger, you run away. You have a little surge of stress hormones and then it's gone. But what we live in now is a society where we have metaphorical lions or tigers everywhere, right? Our finances, our work, our significant others, our children, our health, all the things, of course, not to mention the traffic and everything else, that are these metaphorical lions or tigers that are activating our stress or fight or flight response. So instead of having a little surge that goes away, which is considered beneficial and adaptive to our body, we actually have a high volume that stays on all the time. And that's when we start to see disease.
And so there was a new study. What did it show about like the financial stress and like heart risk? Because of course you definitely know a lot about the heart and how that can affect it.
So as a cardiologist, I was completely struck by this study because obviously when I see a patient in the office, I say, do you have high blood pressure? Do you have diabetes? Do you have high cholesterol? Go through all the medical stuff. But what this study found is that the financial stress and food insecurity based on a survey of, 280,000 people actually may age your heart faster than even the traditional risk factors. Now imagine if you have both together. You're a middle-aged person that maybe has a little extra weight, has a little high blood pressure, has a little high cholesterol, and then you have that financial stress on top of it. You're really talking about a compounded risk for heart disease.
And are all stresses basically the same or is it differences?
No, I think there are big differences. And so when I'm thinking about assessing stress in my patient, I do want to assess a couple of things. One is, what is the stress volume? Like, how loud is the stress? So like, let's say your kids are misbehaving in school. You have a teenager or something and they're acting out. That's a low-level stress, but it's turned on a lot longer, right? Then, for example, a stress like you got into a car accident, got stressful that day, that peaked and went away. The ones that are the worst in terms of stress are really essentially, I like to say, some of the social media and media. We're constantly consuming negative information. And what it's doing, it's turning on that stress volume really high and for a much longer period of time. So when you think about stress, you want to think about how high is the volume going, and you want to think about how long is it really turned on. And either a short amount of stress, a short amount of stress for a long period of time or a lot of stress for a long period of time, both of those can really be damaging.
And I mean, especially with, like you said, media right now, I seem to think every time I turn on the news, it's like negative and it's scary and I understand that that is real stuff that's going on. How, I mean, just between us, like what is some ways that you think you could kind of turn down that volume a little bit?
I think you have to. I'm so glad you mentioned that because I think consuming it all the time turns on your adrenaline, your cortisol. It turns on your fear axis. It turns on your fight or flight response, stimulates your nervous system. And then guess what? It affects your sleep. It affects your eating. It affects your exercise. So all of those things kind of create a domino effect. So I think you need to be very mindful of your consumption of stress. And what you need to do is what I like to say is just set 10 or 15 minutes to stress twice a day. That way you have even if it's a high volume, it's a short little burst. It's not something that's turned on all day. So you need to set limits on your devices, digital detox, as we like to call it, so that it's 15 minutes in the morning, 15 minutes at night of consuming negative information. Now, if you're on your device looking at, some kind of meditation app or reading some Buddhist teaching or doing some positive affirmations, all of that is fine because that's beneficial. But it's really when you're seeing or feeling that stress response getting activated, you need to set a timer on it. So I've started setting like a 15-minute timer on stress. I also make sure that I spend at least 30 minutes after I wake up without my device.
Okay.
So I recommend to people to get essentially one of those old alarm clocks so that you're not picking up your phone first thing in the morning, and making sure that, you're not doing anything like emails or text messages or anything that turns on any kind of fight or flight response for at least 30 minutes until you wake up, because it's not just the stress, but the timing of stress that matters too.
Okay.
So stress first thing in the morning is actually worse for you than potentially stress in the middle of the day when your body's kind of prepared and ready for it.
Oh, that's smart.
Yeah.
And does it make you change like your thinking on how to screen for heart disease?
It does. And so now, actually, not just me, but the American Heart Association has started putting in what we call social determinants of health, where we start to not just think about somebody's biological risk factors, but their social risk factors, their access to food, their access to money, their access to preventive care. And one of the ways in which we do this is when we assess your heart risk, and you can do this for yourself, you go on the online calculator, you type in the zip code that you live in, because we know that socioeconomic status correlates with zip code,
Yes.
as well as things like air pollution and environmental impact and what have you. That's just the surface of the iceberg, though, I think. I think we need to get a lot better at figuring out how to quantify and assess stress. So the other thing I tell people, and I want you to do this too, is to create a stress score for yourself every day. Because the first thing that does is it raises awareness. So I like to wake up in the morning and say, today my score is 8 out of 10, because I've got a lot going on. And then during the day, I'm like, is it still an 8? Did it go down? Is it a little better? Because that way I have a finger on the pulse of what my stress is doing. And I can employ countermeasures, whether it's meditation or box breathing or, just having good positive thoughts, gratitude, to help to counteract that so I can turn that volume back down.
That's smart.
Yeah.
And if they want to go to your website to look up your practice, and I know that you have all the resources on there as well, where would they go?
www.cherrycreekheart.com. And as you said, I'm accepting new patients. And for me, it's really a holistic approach, because I think heart disease is the #1 killer of men and women. And there's so many things we don't understand about it. The environment that we live in sets us up to have heart disease. And so we really have to be mindful, thoughtful, and I love having a preventive approach, because then it's like preventing something for someone before they ever had it.
It's like, Dr. Kohli, thank you so much. We appreciate you. Make sure you check her out on 9 News as well.